Hello, I'm Angelica Foyer, and I'm here with one of our former students. Her name is Jerica Contreras, and she has some exciting news to share with all of you. And please let us know what's the wonderful news that you need to share with everyone here.
Well, the wonderful news is that after doing the 4-day live review, I took my NCLEX exam the next day and I passed it with 75 questions after failing it 2 times prior, going all the way to 145. So being able to pass it with 75 questions was a shocker to me, but I did have a great review. It was like a refresher of nursing school. And it really made me understand so many things that I did not really completely grasp while I was in nursing school. So the way that, the professors went ahead and they broke down everything, including the pharmacology class, understanding how the medication works with the body really does help out, because in nursing school, there's not really a pharmacology class. So all that really just went hand in hand with each other, and it really made me accomplish something that I was so devastated with. And now I'm very excited, and I passed. Once I passed, I started applying for residency programs, and literally the next day I got called for an interview, and I'm now going to be starting next month.
Well, that's wonderful. Thank you so much for sharing all this. So I want to ask you a couple of questions, just, for the students out there who are going to be watching this video. So the first one you already answered, which is it was not your first time, right? You have taken it before.
No, I had taken it 2 times before. I graduated nursing school in December, and I was very confident. I'm an LPN as well. So when I did my LPN, I took it right after I went to school, and I passed it as, with 85 questions. So I was confident that I was going to do the same with the NCLEX for the RN, and that did not happen. So after the first attempt in February, and I failed it, that was very depressing. I went ahead and I scheduled it again on my 45th day in April, failed it again. Just having that failure, it's such a, downer. It does not make me feel good. And then I said, you know what, after spending a lot of money in other review programs, I was, I saw Furor, and I saw it, I believe, in Facebook. So I went ahead and I was like, I read reviews, I saw the testimonials, and I decided, you know what, I'm going to go ahead and do this. I'm going to take a shot at Furor, and I went ahead and, I'm very grateful for that.
I'm glad. So I'm curious to ask you, you said you took some other review courses without giving the names, because it really doesn't matter at this point, but what do you think was missing from the other review courses?
I think it's just that they're more focused on the NCLEX questions, and they're not, they break it down differently, and it's not like a uniform way of breaking it down. And sometimes it didn't make sense. Like, okay, they'll say always think assessment prior to implementation, but then there's questions where you can't do assessment before implementation. So it was very, very confusing the way that they were showing you how to answer the questions. And they didn't really have like a refresher, or, like with Furor, you guys, did a pretty much a refresher and then went to the NCLEX questions. No, they straight ahead went into NCLEX questions, and, pretty much trying to teach you how to break down the questions, but I don't think it was a good way for me to understand how to answer these. I think mainly I needed that refresher to, keep in mind what's important and what's priority and what's first, and, the order of things before I go ahead and start looking at NCLEX questions.
Yeah, what you said is absolutely true. I think that for most students, when they fail the test, obviously it's devastating, but when you start reflecting and thinking, what went wrong? What is it that the school, either the school didn't provide or the review course, and usually it comes down to content. If you don't have a clear understanding of the main concepts, you're not going to be able to answer the questions. There's just no, it doesn't work that way. You need to have that. You need to have a good foundation of content. And then once you have that, you'll be able to apply that to different clinical scenarios.
Yeah,
right?
and that's exactly what my struggle was. These review courses were just mainly about the NCLEX and not really about the content. And you can't really, solve a puzzle without actually seeing the picture.
Right. But you did say you took the review course, the 4 days, and then you went right away to take the test.
Yeah.
And usually I recommend people to take more time, but in your case, it was different because you have taken other review courses and you have had the experience of taking the test. So you were ready to take it.
Yes.
In general, because you took the review course, that I recommend 1 to 2 months of preparation before taking the test. If you were to give some of the students who are going to be watching the video some study tips or recommendation or advice on how to best prepare so you can go and take the test and pass right away, what would be your study tips or recommendations?
My study tips are mainly not to really focus on how you're mainly get the content, understand the content before you want to go ahead and go into questions. We have, all these other review courses and question banks that, you're just taking the question, you're using the question banks and you're just answering the questions and then reviewing the content after the question. When you do that, you kind of get stuck on one way of thinking and one way of learning the content. And my tip would be actually learning how it completely works, not just answering a question and, okay, I got it wrong. This is the rationale why I got it wrong. Understanding how it all works before you want to go in and start doing question banks. I think, doing review videos and, understanding med surg, understanding maternity, understanding all that before going ahead doing questions, that is something that is key. Because like I said, you can't solve a puzzle without seeing the picture.
Yeah, you need to see the complete picture.
Exactly.
You're absolutely right. So this is great. I mean, I am so happy we were able to help you. But of course, you also did the hard work. And I always tell students, it takes 2 to tango. We can give you the great review course. We pour our heart and soul in preparing the best possible comprehensive review, but you need to go over the material. You need to review that content so you are well prepared.
Yes.
Now you have a job, and I'm sure those people out there are thinking, oh, when is going to be my turn, right?
Yes, I thought that as well. I see everybody else in my program that have passed it the first time and already in their program or in their residency program or getting, hired at places, and I'm here like, when is my turn?
Me? When is my turn, right?
Everyone is going up the ladder and I'm stuck.
Okay, but you have a great future ahead of you. And remember, nurses are in demand. Good nurses, great nurses are in demand. So this was a pleasure meeting you, and please stay in touch and share with your friends. I think that there are many people out there who need help and they don't know where to go, and For Your Nursing Review is here to help them.
Yes, definitely. I've already referred to many of my friends. I have about 3 of them that have been struggling. One, she graduated 3 years ago and she's been trying to pass it for these past 3 years. So she's going to get back on that. Once I gave her my testimonial, she actually, I believe she signed up for this one coming up so that she can go ahead and get her head back into the game, because it is very discouraging when you don't pass, and especially if you go more like more than 3, more than 4, more than 5, you feel like you're never
really hurts your self-esteem. You start doubting yourself. What's wrong with me? When it's not you, is the way you're studying. That's what it is.
It's true. It is the way that you're studying, because as soon as I got out of nursing school, and everybody that I finished nursing school with, the first thing that we did, question banks. That's the first thing that everybody goes to once they finish nursing school are the question banks, because they're so focused on the questions instead of the content.
Well, thank you so much, Jerica.
No, thank you.
Wonderful.
Thank you and your team. If it wasn't for you guys, I would not have accomplished something so amazing in my life.
I know. It's a great sense of, it's a sense of accomplishment that nobody can take that away from you. It's beyond happiness, right?
It is. It's tears of joy comes out. You go in disbelief after so many times trying, that when you finally see RN after your name, or you see that license, you're like, I can't believe this is real. This must be a dream.
Okay, great. So enjoy your summer and your nursing career. Okay.
Thank you so much. Thank you.
Take care. Bye-bye.
Too. Bye-bye.